see you again.
Apart from me.
I'm going to Mexico. I don't think I'm pregnant.
Okay.
But it's the paranoia, I think, due to the Zika and everything else. I want to make sure.
How much are you smoking?
1 to 2 a day. Cannabis, though. I find when I don't, I end up taking more morphine.
Can we have a quick look and see? Wow, yeah, that's terrible.
So what are her thoughts about you and the tablets?
Most of her family have died of cancer, and she'd do anything to keep you alive.
Just going to have a sharp scratch of medicine. Stay still. Good man. Good man.
How comes I'm bleeding, you're not?
Well,
I must be dying then.
You're not dying. That's too much paperwork.
I've got a swollen testicle, there's a bit of skin, and there's a bit of the end flapping off and that. And
Goodness.
Around a bit.
I think we need to take a look.
Hello, Farnham Surgery. Nikki speaking. How can I help? Dorothy Broom, please. Take your time, Dorothy. You're all right.
Once you get going, you're okay, are you? Good. It's just stopping and starting. Do you know, before we sit you down, would it be all right if we came across here and got you up on the couch? Because it's your hip you told me on the phone this morning, yeah?
Yeah.
So it started playing up when?
Saturday.
Are you all right to get up there? Oh, dear, don't do that. No jumping allowed.
Oh, OK. It hurts most of the time. But except when I'm lying down in bed, which is nice.
Then it's OK.
Can't stay there all day and all that, can I?
It's when you get up and start to try and get
That's right,
going.
yes. Yeah, getting out of bed in the middle of the night to go to the loo is absolute nightmare.
Right, OK. Relax back for me.
This one.
Have you had both hips done?
Yes.
I thought you had, yeah. Does it hurt when I press in there?
That does, there.
A bit tender there over the back.
Yeah.
OK, now I want you to bend the knee for me. And that's hurting in the same place, yeah?
Yeah, yeah.
And up. That's not bad. Yeah. Let's get you back up, OK? Let me help. There you go.
Ooh. Nothing. As soon as I got in, everyone's just been asking where you are. You do know, you know you're supposed to start at 9, right?
9:30.
Oh, OK, so your 9 o'clock is still already here. I think they forgot to change it on there then.
We don't know yet that there's a definite problem with it. It might just be a bit of inflammation in some of the muscles.
Yeah, and it might get better.
So, are you taking anything for it?
No.
Naproxen?
No, that's it, yes. Now, that's a good painkiller, but it addles your brain, something terrible.
Does it?
Yeah.
Right, made you a bit drowsy, yeah.
Oh, it makes you feel as if you're not in the world, you know?
Anything else?
I've also taken cocodamol.
How much cocodamol?
Oh, only once.
And is that 1 or 2?
As and when, if the pain gets any worse. I'm trying not to take these things on account of you sending me off down to have my liver tested. Yeah.
So, I think at the moment you need regular painkillers, yeah?
Yeah.
So you definitely need something twice a day. If you're going to carry on with the naproxen, Dorothy, we need to have you on something to protect the tummy.
Yeah, I don't like taking all these things.
No, but we're trying to get rid of this pain in your hip.
I know, yeah. I know.
After a couple of weeks, there's no improvement, then we might want to get the hip x-rayed, although without you having done anything.
No, I didn't do anything. And I never fell over in my life till you told me about that, till that balls clinic woman. I never fell over once.
I know.
Right, OK.
Have you got everything?
Pardon?
You got everything?
Yeah, I didn't have any.
Oh, Dorothy.
Yeah.
Did you walk round?
Yeah,
Did you?
yeah. I'm one of your neighbours, you see.
I know you're not far away.
Yeah. I know what's going on.
You take care, Dorothy. Bye-bye.
Good morning. I'm fine, thank you.
Would you mind? It's Rand.
She's Charlotte's mum. Oh, are you? Yeah, she told me to look out for you.
Did she?
She said she's trouble. That's what she told me. So I'm only telling you the truth.
No, she's not lying. She's not lying.
You're in room 3.
Cheers, thank you.
Okay, thank you.
That's nice to meet you. Actually.
Take a seat. How can I help?
Since Saturday, yeah.
She's got very strong lower abdominal pains. Her periods are all over the place. She's got a temperature and she can't sleep, although she's tired. And she's saying that the symptoms are very similar to an ovarian cyst she had a couple of years, 3 years, 4 years ago.
And your periods, what normally happens to your periods?
Normally it was like every 28 days.
Okay, a personal question, are you sexually active?
Not really.
Not really. Okay, when,
That's my fault.
the reason I'm asking is
I'm not
it pain on
pregnant.
intercourse? No, but pain on intercourse.
Oh, no, we didn't have sex for
No.
a long time.
Okay, so there's no pregnancy,
No.
no chance of this. Okay. Okay, I need to just have a feel of your tummy. Okay. But if you lay on your back and just relax as best you can, is the pain getting worse or staying the
it's
same?
like
or?
it's constant pain, but
Yeah.
sometimes it's like getting very sharp.
Are you okay getting up onto the couch?
I'm okay.
Okay. Just relax. Can you point to where it's hurting?
Just
Here.
this side.
And you're not getting any pain on passing of water at all?
No.
Nothing at all. It's there, isn't it?
Yeah.
Okay. Just relax, okay? You can just lay there for a bit.
I'm okay.
Morning. Thank you for sitting me.
How can I help today, Thomas?
Doctor, I'm not getting enough sleep.
Okay.
I'm averaging at most 4 hours every day. The bigger problem with that is when I try to go to sleep, I'm sometimes lying there for 2, 3, 4 hours.
Okay.
What I do is I lay there and I count up to thousands sometimes. Hoping if I start making mistakes, getting numbers wrong, then I know I'm going to fall asleep. But it doesn't happen no more.
Okay. Anything in particular that's changed over the past?
Well, the only thing that's changed is I gave up drinking alcohol a long, long time ago.
Okay.
I was in rehab last year.
And you've stopped completely since then?
Virtually stopped completely.
Fantastic. That is amazing. That's one of the best things that you could have done. So do you feel down particularly? Or?
Very, very rarely do I feel down.
Have you had any thoughts about hurting yourself or harming yourself or anything?
No, nothing like that.
So your mood you mentioned is not particularly down?
No. Since I've come out of rehab last year, I feel like a new man almost.
Good, good.
But it's just this lack of sleep.
Okay.
I think you're not unwell. You're in a bit of pain, but you're not systemically unwell, that I can tell. Urine dipstick. The urine dipstick was normal, but your history suggested that it would be. I don't think we think it's a water infection. My guess is it is a cyst. I think we need to do a scan to see whether it is. And so I think we can get away with giving you some pain relief and some anti-inflammatory tablets to try to calm the pain down.
Yeah.
If the pain becomes more intense, I would go to casualty. If you rupture a cyst, it may require a further treatment, okay? And I'd want you to be seen. What we'll also do, okay, is we'll do some blood tests as well, just routine blood tests. We'll check your hormone profile. We'll just give you a bit of an MOT. Is that okay?
Yeah.
Yeah? And I will give you some painkillers to take. There you go, okay?
Thank you very
Take it
much.
easy.
That's lovely. Thanks for your time.
No problem. Thank you very much.
Cheers.
Bye-bye.
Bye now.
Thomas, there's lots of things that we can do, okay? I'm going to print you off a leaflet, which is a sleep hygiene leaflet, and it tells you everything that you should be doing. But in addition to that, I can give you a small amount of medication that will just help you get to sleep. Okay?
Can I ask you one more question? This is just a mild one.
Usually in a 10-minute consultation, we can only deal with one thing.
But I can look up online what the problem might be.
It's better that you make another appointment to discuss it with us.
Okay.
Because what we don't want to do is we don't want to miss anything. That's the thing.
Yeah,
We want to make sure that we deal with all of the problems effectively.
Okay.
So it's really important that we get these things sorted. Now, for the sleep, the medication I'm going to give you, Thomas, I'm only going to give you a very small amount.
Okay.
So you take one, maybe tonight, tomorrow night, and then stop, see how you go. And then if you're back in the routine, fantastic. If you feel that you're better, not quite there, then you've always got that medication to fall back on the last 5 minutes.
If we get even just 5 hours, that would be wonderful.
There we are, Thomas.
Okay, thank you.
All right,
much, then.
no
That's
trouble.
wonderful.
No
Okay,
worries.
doctor, have a nice day then.
You too, buddy.
Thank you much.
No worries, Thomas. Bye-bye now.
Bye-bye.
Can I help? If anyone has an appointment, you can check in on the self-check-in. Hiya.
I want to make an appointment to see my doctor.
Hello, come in.
All right.
Hi there. Okay, just take a seat, lovey. So you've come for your asthma review, Amanda. How often are you using this in a week?
I've been using it quite a lot.
Okay. Show me how you use it, please.
Is there any in it?
It should be. Stop.
They're running out as well.
1, 2, 3, 4, 5.
It's empty.
6. Shut up. You're joking?
Yeah, it's
You've
empty.
given me the empty
I haven't
one.
got one.
Have you? You haven't got one.
Not the blue one.
Okay, so this is empty. So what we'll do is I'm going to make sure you've got plenty on repeat.
I feel guilty now because that's my fault because I should have checked.
We're okay because she didn't have an asthma attack, so don't feel guilty about it, okay? Because we've resolved it, all right? Now, do you have any asthma symptoms during the daytime? Cough, wheeze, tight chest.
It's mainly wheezing.
Does your asthma stop you from doing anything?
No.
Great. So basically, you take your pink one as prescribed,
Okay.
then you're using your blue one when you've got symptoms.
Could you...
Now,
Sorry. Could you write that down just in case
yep,
I forget or
Yep.
my missus forgets?
yep, that's fine. I was going to give you a little plan.
Yeah, I was going to say.
So, if I don't feel better, give me 2 puffs of that's the blue one,
Okay.
and then you can have a maximum of 10 puffs.
Okay.
So that means that you're struggling to breathe, so you take your blue one because that's going to open your airways quickly, and you have a maximum, as it says here, 10 puffs. If you're needing 10 puffs, we need to see you.
Okay.
Yeah, because you might have a chest infection, we need to have a listen to your chest. Or if it's really bad still, you need to go to the hospital. Okay?
Yeah.
I'll give that to you.
Thank you.
Is that okay?
Yeah.
So that will sort of jog your memory a bit. Do you want your flu vaccine, darling?
Yes, it's
Great.
both of us.
Are you right or left-handed, sweetheart?
Oh, my God, no, not that.
I'm having this one, but I can't do
Okay, that's fine. He's turned away.
I don't like needles.
Done.
it. See? It's quite
Well, I don't
easy.
care, and I start sweating as soon as the needle goes in me, I'm
It
gone.
didn't even hurt.
What, am I giving you your flu vaccination?
Well, I ain't got a prayer, have I?
Because you need to help her. You can't be sick.
Swap the seat, because I'm telling you what, I'm sweating up and I ain't even had it done yet. I'm right-handed, you can't hold my hand.
Yes.
Should we do it here?
No.
No one, Mum, we'll be fine.
Sit here. Sit here. Pull your. Tell me
Sweating
which
up
arm
already.
you want. Which arm do you want it in, Gary? Here.
I'm right-handed.
Okay, let's do it in that one. Okay.
I'm in the wrong seat.
No, you're fine.
Scratch.
Right, just going to have a sharp scratch of medicine.
Stay still.
Good man. Good man. Hold that there for me. Thank you very much.
How comes I'm bleeding, you or not?
Well,
I must be
there.
dying then.
You're not dying. That's too much paperwork. I am going to go and get your wife's prescription signed. If you both take a seat in the waiting room, and I'll be back in a minute.
God.
Okay. Oh, I need somebody.
I'll watch it.
Thank you.
I'll be there in just a minute, all
Cheers,
right?
a bit.
Okay.
Oh, that's sore now. Ow! Where are you going? I'm not walking back out. Didn't tense up, did I? Yeah, I hate needles on. That bloody hurt.
Nice to see you all.
And you?
I'm Dr. Tawana. How can I help today?
I've spoken to you a couple of times on the
Okay.
telephone about Annabelle's condition.
Okay.
She's broken her arm
Oh,
3
okay.
times.
Yes. Tell me
About
what's been
her,
happening.
well, the physio that she had after her last break said
Mm.
she had hypermobility.
Okay.
And we thought that had gone on the records, but
Yes.
it obviously hasn't. So
Okay.
we thought we'd make an appointment, come
Yes.
and see you,
Yeah.
to get her checked over and to confirm that's definitely
indeed
what
the
she's
case.
got.
Well, what we would need to do, has she ever seen a children's specialist?
No.
No. That's what we would
Oliver,
be
no,
considering doing, just because a diagnosis of hypermobility tends to come from our specialist.
Yeah.
Hypermobility syndrome is a condition where you can see a bit more flexibility of joints. In addition to the increased flexibility, other signs and symptoms may include pain of their muscles and joints, tiredness, although there are some less common symptoms which can include things such as bruising easily, headaches, abdominal symptoms as well. Can I just check, with these fractures that you unfortunately had, were they pretty much innocuous kind of injuries, or actually was some force that these fractures occurred with?
The first one she had was just falling over a bouncing toy we had, and she just fell on the floor.
And then
And
broke the bone there?
That was the worst one, because she
Yeah.
had the op for that one.
It's okay.
And pins.
Yeah.
And the second one, she fell from a climbing frame, which gave her a green stick fracture on this arm, I believe. And then
she went up the slide there and
she fell off the slide and did this one again.
Right. I think what we need to do, quite simply, is get you seen the amount of fractures that you've sustained. I think it's a reasonable diagnosis, but I think just for formality, to get it properly confirmed.
Yeah.
The vast majority of patients that are affected will actually get better and will grow out of their symptoms and improve over time. So leave that with me.
Brilliant.
I will send that referral off in the next day or so, and they will contact you directly with a letter, I suspect, at the home address, and we'll go from there.
Brilliant.
Do you want to see? Yeah. Pop this in your ears. There you go. And then what you do is I'll get you to hold it just there, around about there. Does it sound good? Lovely.
Thanks,
Okay.
Doctor.
Take care, guys.
Come on then.
Bye.
Bye.
Bloody hurts. Please help. Pain.
Dr. Trees, this one.
Yeah.
Come in.
Hello, Doc.
Hello.
It's me next.
Hello.
Saviour. Saviour coming out. Got a little problem.
Okay, let me bring up your... So you're managed at Mount Vernon, aren't you? That's
Yeah,
the main,
well,
main
sort of,
site.
yeah.
When are you due... So you had
Oh,
some...
I've got to go there today.
Okay.
Radiotherapy.
How are you?
Oh, apart from I'm just gone under 10.5 stone, not too bad.
So you've gone down to 10.5 stone?
No, just under 10.5.
Okay.
These are the tablets I'm supposed to be taking.
Yeah.
I don't really like any of them. I tried to tell my wife to crunch them up, put them in any old drink, give it to me.
Mm.
But she don't like doing that. She's an honest woman.
What do you not like about taking tablets?
Getting them in without me being sick.
Okay. So you feel quite often the tablets sit in your throat?
Yeah.
Okay. Because there are sometimes other reasons why people stop taking tablets, because they're just fed up of life.
Oh, God, no, I'm not fed up with life.
Right. So that's what I was trying to gather from
Jesus
talking
Christ,
to you.
no. I've got £20 each way on Slough Town winning the league.
Right.
That's £665. Who wants to die when I get that?
Okay. So what would you do if you won that money?
Give it a wife. Something stupid.
So she's your major rock. So what are her thoughts about you and the tablets?
Her thoughts are that most of her family have died of cancer. And she'd do anything to keep you alive.
How can I help you today?
So I'm late. I don't think I'm pregnant, but purely for the fact that I'm going to Mexico in 2.5 weeks.
Okay.
Due to the Zika and everything else, I want to make sure that...
Did you do a pregnancy test at home?
I've done that. It came back negative.
And usually your periods are regular?
See, yeah, usually yes. But I think I may have messed them up a little bit. Initially, we had booked Mexico to go and try for a baby. Then the Zika thing kicked off.
Okay. So Zika virus is carried by a particular type of mosquito. In 2015, there was an outbreak of Zika virus infection. And since then, it has been spreading in many areas of the world, particularly South America, Central America, and many of the Caribbean islands. There are other methods of transmission of Zika virus through blood transfusion, sexual contact with a person infected, or pregnant women can pass on the virus to the babies through the placenta. But you have been using condoms?
Yeah, we've been using condoms.
So no unprotected sex?
In my heart of hearts, I know that nothing's happened, but it's the paranoia, I think, because I'm never late.
Yeah.
I have bought a test.
Okay, if you have a test, you could repeat it.
Okay.
Yeah?
Yeah.
So I would prefer you do the blood test, because blood test is more sensitive. It will just tell us the hormone levels.
Okay.
If it's less than 1, then we know you're definitely not pregnant.
Okay.
Why don't we do that?
Okay.
Yeah?
Yeah.
The main concern of a Zika virus was the adverse effect it can have on babies. Zika virus can lead to birth defects, especially microcephaly, which is less developed brain and a small head. And there have been reports of premature deaths.
The other question I had, when we come back, obviously then onwards, like that's when we do want to try. But I've read on the NHS website that when we come back, we're still not allowed to have unprotected sex for at least 8 weeks.
Because there's an incubation period there, isn't it? Yeah. As Zika virus can lie dormant, it's really important that you take precautionary measures. Men who are traveling to the countries infected with the virus should ensure that they use condoms during travel and at least for 8 weeks after they return. Women of childbearing age should also avoid getting pregnant for at least 8 weeks after they or their partner have traveled to a country infected with the Zika virus.
What are the symptoms?
I mean, it's more generalized symptoms, fever, aches and pains, anything that is, you feel unwell, we say come and see us, especially if you have traveled.
All right, so then you would just test us if we are ill.
If we have any symptoms,
Okay.
yeah? Okay.
All right, that's fine then.
All right.
Okay,
Okay, take care.
you.
Bye-bye.
Cheers.
She really wants you to be taking the tablets.
Well, when I take them, I'm sick. Because I see the tablets.
Yeah.
And it's just my natural reaction. I've got a little feeling just there.
Yeah. Because remember, where the cancer is possibly one of the reasons why you are having difficulty.
Yeah, of course it is.
What you've got is on the left tonsil and base of the tongue, there was a tumour.
Yeah.
And so they're trying to shrink it with radiation.
Yeah, doing it.
So how long has it been since you took your tablets?
Well, if I told you, you'd have a heart attack.
So I'm putting them out here so that we can sort of see what you're taking. They are actually more symptom type things. So this is meant to stop nausea and sickness. What happens when you take them?
I get sick.
Okay. You could manage without them, that's fine. If you don't want to take that, that's
Right,
okay.
so we put them in there.
We put them in there.
That's a bin.
This is if you have loose stools, diarrhea.
Oh, we put them
This is
in there.
Imodium. Okay. This is a steroid medication.
What are they for?
What these do sometimes is just help sort of improve your appetite, for example. Are you eating okay? Do you
No.
still have an appetite?
No.
So you're not eating well?
No. That's why I'm losing weight.
Have you seen...
A dietitian? Yeah.
No. So I need to organise that for you.
Yeah, but I can organise that at Mount Vernon.
Vernon.
So you can get rid of them. So that's it. It's job done.
So if you want to manage without that and then start off with the dietitian...
How about ice creams?
Fine.
So if I go and get 20 ice creams and stick them down my throat. That's fine.
Obviously, it'll be better to have a varied diet. You'll feel
Right.
sick of ice creams very quickly.
I won't. What about these bottles of...
The drinks.
The drinks.
Something like
Yeah.
Complan.
Yeah?
This would be a start, but I really recommend you do see a dietitian. Okay?
Oh, yeah. I'll see one today. I'll go down there early.
Okay.
I'll look at it this way. If I don't eat, I'll die. And that's an encouragement for me.
Okay. Good. Is that all right? Do you have any
Fine.
questions?
No, not at all.
Good. Do you feel okay with the, when we were talking, you were quite upset initially, but do you feel you can tackle this now?
Yeah, of course I can.
Okay.
Simple.
Good.
Thank you very much,
Let
Tom.
me know if there's any problems with Mount Vernon, okay?
Nah, they won't be.
Take care.
Don't worry about me.
I'm sure many people do.
Come in. So 5:10, Dr. Lee, room 2. You're very welcome. All the best. Bye.
A lady was given this for her daughter, but the pharmacist told her no, it's got to be 2 grams.
She is 3.
My granddaughter, she's 4.
Granddaughter.
Yes.
As they say, time has been untruthful.
Oh, yeah. Can we come? Oh dear, they're all going to experience this, are they? Oh dear. Okay. Come in, everybody. Oh my goodness, how many more? Is that it?
No, the other 2 at home.
Right. So you want a jab, is that right?
Yeah, the left hand's coming back, but the right hand's starting to hurt as well again.
I need to get you to sign a consent form, is that okay?
Yeah.
I'm 20 stone.
She's not 20 stone.
Okay, so basically I'm saying that you're having a steroid injection to your left carpal tunnel with the idea to reduce pain and symptoms. There's a small possibility of infection, bleeding, pain and recurrence. And if you're okay with that,
Yeah.
you just sign that. Fantastic.
I've had enough.
I'll get this ready.
On my birthday, can I have pasta, popcorn chicken,
And pasta?
pizza?
Your birthday isn't till next August.
Can I have pasta?
Okay, so that has to turn over this way.
Oh, it's the other side, isn't it? Yeah, they've just introduced this healthy eating at school. They're not allowed crisps, they're not allowed chocolate bars. And I'm like, well, that rules out him eating anything.
Oh dear.
Plain slice of bread
A
and
little
a
quick now,
carrot.
sorry.
Oh.
That
bit more.
Oh, am I good to go? Don't cry. Don't do that.
Well done.
You try having it pipe and tell me it doesn't hurt.
You've done really well. She's done really well.
It stings really, really bad.
And it looks disgusting.
Let's see how that goes.
Okay.
I'd use a little bit of ibuprofen just at the moment to see
Yeah.
if the anti-inflam helps. You may find that when the weather cools down a little bit, it may not be as bad either because there'll be some fluid retention.
Yeah. Come on then, just gonna get you dinner. Thank you.
Right, everybody. See you later.
There we go. Oh, it's never for the receptionist. I'm really glad it is. There we go. He loves you.
Oh, and I bet there's 28 there as well. Thank you.
Hello, Dr. Nanda. How are you?
Not bad, how are you?
Yeah, fair to middling.
Good. Before I forget, you're due for the flu jab.
Yeah.
Shall we do that?
Yes, please.
Okay, let's do that. Especially when you're, from what I can see, relatively sort of well devoid of any infection or anything.
Well, I've just got over a chest infection.
That's okay.
So
you're not
3
really
weeks ago, I was given antibiotics.
I saw the notes, yeah.
I've known Kevin Brown for the last 2 years. He's got multiple medical conditions, some of which include problems with the heart, problems with the lung, emphysema, which is scarring of the lungs.
Still smoking, are you? Or?
Occasionally.
Occasionally.
It's not cigarettes, though.
Sharp scratch? Sorry.
That's okay.
Hold on. How much are you smoking?
1 to 2 a day. Cannabis, though, helps with the pain. And I find when I don't, I end up taking more morphine.
Cannabis in its raw form is injurious to both physical and mental health. However, I do think there's a lot of potential for the ingredients, if it's well formulated in the right appropriate amounts, to be used for some medical conditions like glaucoma and relief of nausea in chemotherapy patients, and also multiple sclerosis.
So this might sound a bit repetitive for you.
I know.
But smoking
I understand.
in the setting of emphysema is going to worsen the situation and also increases your risk of frequency of infections.
Yeah.
So let's have a quick listen to your chest, especially after the infection that you've been. Thank you.
I do feel there is more research that is needed to unlock the potential of cannabis. However, the early results are promising.
So they've done the flu jab today, and the chest is absolutely clear for a change, and I'm quite pleased.
So am I, actually. I can breathe, you know.
That's good. I think you've done pretty well.
I won't go to hospital. I'm a terrible patient.
Yeah, if you look at the last 4 to 6 months, I've not seen major admissions there.
No.
So that's a success story.
I won't go.
Yeah.
I'll just suffer at home. If I go to hospital, I'm open to infection.
That's right.
You know, the last time I was on a respiratory ward, I ended up with pneumonia.
That's right. Hospital-acquired infections, as well as other types of issues.
And I know that pneumonia with my present condition is not going to be friendly.
That's right.
So thank you.
Let's try keeping in the community. And
Well, I'd rather stay in the community. You know,
that's right.
I'm grateful for the way I'm being treated here. It is a marked improvement from my last surgery.
I'm pleased. Okay, all the best. Yeah.
Thank you.
Take it easy.
Thank you.
How are you getting on? Skin improving a bit? Or not?
Nah, it's getting worse. And my arthritis is getting quite bad as well.
Okay.
My joints.
What I'm going to do is I'm going to try and get the girls who organise what we call patient services to try and see if they can push some of these appointments.
Yeah, no, that's fine,
because
yeah.
I think, you know, it's obviously, you know,
Yeah.
affecting you really badly at the moment, and we need to try and push them to try and get you in as soon as we
fine.
can. So I think that's what we'll try and do there.
Okay.
Okay.
Ryan has a very severe case of psoriasis, probably the worst that I've personally ever seen. Linked with that, he also has a type of arthritis which is related to the psoriasis. Both of these conditions are caused by an autoimmune problem, so his own immune system is reacting against his skin in particular for the psoriasis and against the joints for his arthritis as well.
Which joints at the moment are being affected?
It's my knees, really.
Yeah?
Yeah.
Are they swelling a lot?
No, they're not inflamed or nothing. It's just really tight.
So it's just tight. Okay, can we have a quick look and see?
Yeah, my psoriasis on my leg's quite bad, though.
That's all right. Dearie me, having a shocking time, aren't you? Wow. Wow.
Yeah.
That's terrible. Has it improved at all since you've been on the methotrexate?
No.
Because you were off it for a little while at one stage, were you, or not? Yeah. How long were you off it for?
Not that long.
No?
No. But it's really bad.
Yeah, I think you've proven your point to me. Are you using anything else at the moment just to moisturise?
When I get in a bath, I use my Cetrabend thing I've got.
Yeah. Okay, use that as a soap substitute.
Yeah.
Is that right? Okay. Are you getting out in the sun and trying to blast it like that?
Best thing I ever had treatment-wise was the sunbeds.
Yeah.
Cleared up straight away.
We've known for some time that people with psoriasis do better during the summer months when they have natural exposure to the sun. People who use sunbeds will often find that their psoriasis is helped as well, although there would be very few occasions when I would actively tell a patient to go and use a sunbed. In Ryan's case, I think that's a reasonable thing to do short term, particularly if he comes in to be seen and examined to make sure that there are no other issues associated with the sunbed use.
So that's just the Cetrabend, okay, which, you know, is a bigger amount, so it's about a litre of it. Okay, because you just need to try and moisturise, I don't know, because your whole skin's flaking off. Do you need anything more from me?
Yes, I do. A sick note, if that's possible.
Yeah, I'm happy to do that. Okay, mate, that'll keep you going on that. Okay.
Yeah, okay.
I'll go and speak to the girls now and see what they can do.
Okay, that's fine.
No
Don't we
promises,
sort
but
that
I mean,
out,
we've got
or-
to. They'll get back to you.
Yeah,
about
don't
that,
we sort that out, or?
Oh, don't worry about
Yeah.
that. We'll sort it out.
Sorry about that.
Okay, mate. I'll see you later. Yeah.
See you later.
Bye bye.
Just to let you know, there's a guy with a lorry with the vehicles blocking people coming in and going out.
I don't know who
You're
is
going to
that
get a lot
is.
of people coming in saying, I can't get into my appointments and blah, blah, blah. I mean, I come in and said, I can't park, mate. I said, you're going to have to get out of the way. But anyway, I've got an appointment at 3:20.
Hi, come on in. Thanks for waiting. I'm Dr. Tawana. How can I help, Patrick?
I've got a swollen testicle.
Yes.
I've been off work for 5 weeks, and now where the tube comes out the testicle, there's a bit of skin and there's a bit of the end flapping off and that.
Goodness. I think we need to take a look, just from the description you've given me. And this has been rumbling for some time, you mentioned.
Now? I mean, I've been up the hospital, I've had an ultrasound and everything like that.
I'll have a look to see if they've come back to us. All right, let's have a look.
You just feel around it, there's a lump, little bit of a skin, and then the end of it's coming off.
You'd be pleased to know that that's pretty normal anatomy, actually.
Is it?
Yeah, that's all right. But certainly, I would agree.
I've still got the swelling.
You've got swelling. Is it just this side or the other side?
The other side's all right. That's normal.
What about pain?
Pain I'm getting is up here.
Okay. I'll let you pop your clothes back on. We need to work out what we do from here, don't we?
Yeah.
The ultrasound result, it doesn't seem to be coming up in the record.
They said about 6 weeks for it to get better. It's been over 6 weeks and it hasn't even started getting better. I've got a daughter to feed and everything like that. I've got bills running up everywhere and that. I've got to try and get back to work as soon as I can, you know what I mean?
I hear what you're saying. However, it doesn't look like you're in a position to be working. We think this is a long-term infection within the testis itself. So we must press ahead with high-dose antibiotics. So I'm going to give you that today. Now, the hospital will call you to organise your ultrasound scan. I'm going to request it as an urgent one.
Yeah. It starts getting worrying. I'm nearly bloody 50, you know what I mean?
That's middle-aged. That's not that old.
Half my friends are dead, mate. Most of them didn't make it past 40.
Okay. Why is that?
Oh, just all sorts of different things, you know what I mean?
That's your sick note there, Patrick, OK? Another 4 weeks' worth of antibiotics, all right? And we'll go from there.
OK, thank you.
All right, Patrick.
Thank you.
Take care.
Oh, God. I want to get back to work.
I bet you do. Take care.
Hello, how are you, Mum? Nice to see you. This is Hafsa.
Hafsa, yeah.
Hello, Hafsa. And who's this? Older sister?
Khadija, yeah.
Hello, how are you? Just take a seat. So how can I help you today?
She's been sick for a week now. She had a fever, especially last 3 days. She was fine like this, but she's gonna cry like she has some pain in the stomach or something.
All right, okay.
So, yeah.
Just now and again?
Now and again.
Now and again, okay. Right, good. She seems to be pretty full of life. Do you want to get onto my computer? Maybe you've got some medical talent here that we should that we should know about. So just hold your head. Could you take your temperature, darling? Yeah, we are. Well, she's done quite well. So I just want you to hold her. Yeah, just one arm around her arms and one arm around her head. That's right. So let's just look into your ear and see what we can see. No kicking, Hafsa, please. Now, right round the other side. No, don't kick the doctor. You can kick your members of your family, but not me. That's right. Because we're just looking in and seeing what your ear is like. That's very good. You're a very friendly girl, Hafsa, I'd have to say. Now we listen to your heart, just to see how fast it is. Oh, yes, good. That's fine. She has, as you can hear when she breathes in, she's making a noise like...
Yeah, she does that.
And so that's because she's got an infection in her airways. This is a fairly mild infection, but it's going to give her a temperature. It's going to give her some abdominal pain and probably pain in her throat and in her trachea because it's inflamed. Not badly. Give her Calpol when she's in pain. I think she'll settle down fine. I think I wouldn't be worried about her.
Oh,
Yeah.
that's fine.
Good.
Thank you.
Bye-bye. I'm going to shake hands. Bye-bye.
Bye.
Bye-bye. Nice to see you. Yeah.
For some reason, you've missed your appointment. I don't know why.
Hello.
Hi, Dr. Lee. I've had a lady waiting at reception for you. Her appointment was booked with you for 4:10. Can you still see her?
Yeah.
Okay. Okay, thank you very much. Thank you, bye. Okay, if you'd like to take a seat in the waiting room, he will see you. Okay? Hi, can I help? Hi.
Okay, take a seat in the waiting room. Thank you.
Mr. Zach?
I'm coming, just one second.
No worries.
Thank you. Oh. Oh.
Hi, morning.
Good morning.
Come in, have a seat.
I will.
If you can.
Oh, I can.
You can?
Oh, it's 9 days now.
Right.
And it's not getting any better. And today, even because I came to see you, I didn't take any painkillers.
Tell me what's the background to this.
Week ago, I wake up in the morning with a little bit of pain on my right-hand side, get difficulties to get off the bed.
Okay.
Reason why I came, because, you know, I can't really sleep 3 hours a night, you know, and then, I don't know, maybe I should go for some x-ray, I don't know, I don't really know.
So, with this, you woke up at the start of this with the pain and it's from what you described. Whereabouts is the pain?
Is around here, you know, around this area. But what's happening is, you know, when I let's say when I standing up, you know, and I want to get straight up, the pain from the back going to the front, you know. So when I straight up like this, I can feel pain here and there, you know.
What do you do for a living?
I'm driving, you know, I'm taxi driver.
Can I examine you? If that's all right.
you can.
Can I get you to straighten your knee and then lift it up as high as you can?
Oh.
Now, can you tilt this foot backwards?
I can.
And is it causing
a little bit? Yes, a little bit. Yeah.
So when I push it backwards.
Oh yes.
Yes.
Yeah.
Okay. And then you can relax it back down. Fine. Okay. This leg, can you lift it up?
Oh my God. Yeah.
That aggravates it as well.
Yeah.
Okay.
I was trying. Oh no, I can't go any further. Oh yes. Oh my God. No, don't go any further, please. Oh.
Can you tilt your foot backwards in that position?
No, I can't.
If I get you to do that.
Oh my God, no, please.
Okay.
Oh.
So it's aggravating. I'm sorry, in every way.
Come and take a seat. You don't mind if Catherine sits in and watches, do you?
Yeah.
Yeah? You happy with that?
Yeah, fine.
Good. So you want me to jab you again, eh?
I do. I've been having terrible trouble.
Yeah. Where's most of the pain now?
It's actually it's down here, and it's pins, all fuzzy, pins and needles, and it's a pain.
Yeah. So don't forget, just like last time, it will probably hurt for a few more days afterwards. Okay.
Yeah.
Were you happy with that last time? Did it hurt much more, or?
No, just the same as the other
About the
times.
same.
Really.
Okay. And what about? And don't forget, I'm sticking a needle in you, so it can, you know, it's possible that it can cause infection or it can cause bleeding.
Yeah, that's.
Happy to accept
yeah,
that risk,
I've already had it, so.
Yeah, you know what it's like.
I know more or less.
Okay, let's do this, shall we?
hate it when it's...
It's not a nice thing. So, okay, let's pop this hand out here, just on there, up in that direction. Just a bit of cleaning, eh?
Yeah, my hand cream.
Prick now. Well done. You're doing really well.
Oh, worse than ever. Oh, finished.
I think you've obviously got back pain, but there's some element of sciatica here going down the leg. But I think most of it is strain in the back.
Okay.
We need to try and relax the muscle there. I have got some concerns about you being able to drive in this position.
See, when I take the painkiller, I slowly can get into the car and get out of the car, you know?
It's the unpredictability of you maybe losing power in your right leg. So if you were operating, obviously, the brake and things, there is just a bit of risk there that you need to...
I need to consider,
As a taxi driver, you have a duty of care, so therefore, I would strongly urge you not to drive till your comfort is back and there's no pain. Yeah. My feeling is with the spasm in your back, you would benefit from something to relax the muscle.
Okay.
We don't often give this for every type of back pain, but with the spasm you've got, I think some diazepam could help you. So maybe then, to keep things a bit simple, we'll give you cocodamol, but the stronger version, 30/500. You could take this diazepam to help relax the muscle. But with those medications, you're really not allowed to drive.
Okay, yeah, that's cool.
So don't take paracetamol on top of this cocodamol.
Thank you very much. Let me just get off the chair. Oh, oops. You see, that's the problem. I wish to be a little bit, like, quicker, you know, but it's just get these stages when my body is just say, stop there. Okay, here we go.
Hopefully things will loosen up and you can move. Okay.
Thank you very much. Have a good day.
Care.
Take care. Thank you.
Okay.
I try to do my best. Thank you.
All right.
Finished. Oh.
Hold on. All done. You've done really well.
That was worse than it's ever been.
That's probably because it's more tender than it's ever been as well, isn't it, eh?
Oh, that was bad.
Let's go.
See how much I've been suffering then. Oh, I feel like crying. It was that bad.
Yeah. Well, so it's a deep injection, though, isn't it? You know, it goes
I don't
deep
know.
into there.
I don't know. Well, just all I can say, I hope it works after all that.
Julie? Yeah? Have you been trying to call him Mr. Mohammed this afternoon?
No.
You tried him twice. Somebody
I?
did. No, somebody did. But he missed the call because he was asleep.
Oh, well, they'll have to try again tomorrow. He's gone. He's gone. Oh. He's gone.
But I put him on the list for tomorrow.
Lovely.
And I said, can you make sure you don't fall asleep?
Honestly, with your telephone on next to your head, so you...
Nice to see you.
Come on, Marcus.
Come right in. Yeah. We have Catherine here, who's a student from Southampton. Hello.
Nice to meet you.
How are you? Okay, right. So, Marcus, what can I do for Marcus?
So he's been in hospital.
Yeah.
But for cellulitis.
Yeah.
But he's been self-harming very badly this week, and I'm not sure. They've told me to come back to the doctor.
Yeah.
To be referred to something, but he's just...
Has he ever been to CAMS?
Yeah, he's on medication.
Yeah.
He's just so angry.
Is that right? Okay. So what other medication is he on in terms of, is he on anything from the ADHD point of view?
He's on Strattera.
Okay.
And he has melatonin at night.
Yeah, very good.
But this week he's got a massive barbecue fork and he's been trying to stab himself and
Has he done any damage at all?
I'm not too sure. Like, there's a couple of marks that have come
Just
up.
sit forward, Marcus, let me have a look. Yeah, just nearer me than that.
You need to sit like that with your head up, maybe. I think there's a little mark around there, but I got them off of him.
Yeah. Marcus, from the age of 2, had problems with attention span, problems with behaviour, and language as well. And it was eventually decided when he was old enough that he met the criteria for ADHD, attention deficit and hyperactivity disorder.
ADHD manifests itself in 2 or 3 ways. So it can focus on hyperactivity, unproductive activity, disruptive activity, with sometimes a lack of focus, particularly on learning. How are you feeling, Marcus?
Not good.
Really? Not good in what way?
You need to tell the doctor.
What's school like? The school's lying about me.
Saying what?
Like, they say my mum was gonna batter me, but that was a lie. I never said that.
They said that she was going to do it, or they said you were saying she was going to do it?
He went into school last week and said I battered him. So obviously
I see.
they checked him all over.
Yeah.
But because he's lied about me, I took his iPad off of him and his Xbox.
Yeah.
I never lied.
So then we get this, the school's lying.
Yeah.
It's getting
difficult,
very severe at home with the self-harming.
Frustration is very common with ADHD. Self-harm is prevalent, but it doesn't affect everybody with ADHD. It's a very difficult condition, and very difficult for Marcus to deal with.
Absolutely.
And very difficult for you to try and do your best as mum. It's difficult all round. But I think the amount of support is the key, I think. The amount of support, advice, and options and opportunities to give him, worthwhile distraction, so that he's doing something he likes and that actually gives him enjoyment. In managing ADHD, you're trying all the time to minimize disruption. And one of the first ways of treating and managing ADHD is to improve the library of techniques. So the focus is very much around family therapy and parenting therapy. And one of the most useful techniques is getting the child to focus on something that they're interested in and that they're good at. And if they can find that one thing, then that's the way towards salvation, I think. What made you take up golf?
I don't give up.
Good. And do you like it? Do you? Would you like to be a professional golfer when you grow up?
Yeah, I just want to be this guy. He's called Happy Gilmore.
Yeah.
Yeah, he can just batter it over about 5,000 meters.
That's a long way.
Very far.
4 miles. So how many times a week do you play golf?
2, no 1.
Once a week, usually, isn't it?
That's terrific. I'm really impressed. That's very good.
I'll go today.
You've got to go to school.
No, I'm not.
So I'll ring them up. But have you got you've got all their numbers, haven't you?
Yeah, I've rang the crisis team and everything. So they've not contacted.
But have you rung this number in Upton, the 635645 number? Yeah. And what did they say to you?
They said they get a doctor to ring me back, but I've not had anything.
Okay, I'll get on to
Yeah,
them
that was
today.
last week I rang them.
Yeah, I'll get on to them today.
I'm not going to do it. I'm done school.
Marcus, you have to go to school now.
I'm not going to school!
Stop it.
Why do you not want to go to school, Marcus?
They're dumb liars.
Right, well, maybe...
Well,
Still not. Starting to say it again.
Okay, well, maybe we'll just have a meeting with them and see what we can do, some work from home.
No, they're going to lie like they do.
Why don't I just get some work and we do it at home together? Yeah? Yeah? Is that better for today? Yeah? We'll do that then.
Mum, why do you believe in adults and not me?
it's very difficult.
Very.
Very difficult. I know it must seem so
Why do you
unfair.
not believe me? I tell the truth.
I do believe you, darling. All right then, what
Good,
do you
I'll
say?
get on to them. Yeah, it's nice to see you. Yes, just keep up with the golf, okay? Don't worry too much about school. Don't worry about anything else that upsets you. Just worry about the things that you can do really well in.
Yeah?
Okay? That's the key to being happy in life.
Okay.
Stay with what you're good at, and just get better and better and better at it.
Thank you very much.
Yeah,
Lovely
nice
to see you.
Yeah. All the best.
And to you. Thank you.
Bye.
Bye. Nice to meet you. Come on then. How can I help?
I've had my hip replaced, I've had my back replaced, I'm blind in my left eye. Every part of my body was aching.
I'd like some hemorrhoid cream, please.
A couple of days later, the red eyes came. I'm definitely left ear. I can't breathe out of my left nostril.
Hernia's coming back again.
And all that pus.
Sickness, diarrhoea.
Can I have some more of those antifungal tablets?
All my teeth fall now.
Headaches, giddiness.
She also said to ask for some Imodium liquid.
I've been incontinent for a couple of years now.
For somebody with COPD, atrial fibrillation, multiple myeloma, hypertension, and carpal tunnel, you're doing pretty amazing.
Come and take your seat. Cheers. So you're not great at the moment, is that right?
No, they thought I had a bug about 3 months ago because I kept on coughing.
Yeah.
And they gave me antibiotics, inhalers, steroids, never worked for 3 months.
Yeah.
I said, yeah, because they thought it might be lung cancer.
Right.
Which had come back clear, so touch wood, there wasn't that. Then they sent me up, because I'm out of breath from my stomach swollen. I've got mild heart failure.
Right, OK.
And I've been on water tablets now for about a month, but they've done nothing. My ankles are still swelling.
Yeah.
I'm still coughing in the morning, and my stomach's still bloated.
OK, let's have a look at those legs. OK, come and have a lie up here for me, Terry. I'm just going to put it down slightly. OK, so lying down doesn't make it any worse?
No, no.
OK, I'm going to listen to your back. Good. Interesting, your chest is really clear.
Yeah.
You do have some swelling there.
Yeah.
It may be that you've got some swelling in the belly as well.
Yeah.
OK, but it's difficult to tell. I mean, there seems to be a fluid level when I do this, but I think we need to get an ultrasound to try and work out whether that's the case or not.
Right, yeah.
OK. All right, so I've sent off that ultrasound. OK,
Right,
so
yeah.
that's been, and they will contact you about that.
Yes.
OK. OK, that's all I'm going to do at the moment,
Okay.
mate. OK, so we need to get that ultrasound to have a look and see what's going on with the tummy. Okay?
Right, yep.
So we'll see from that. They'll tell us if there's any fluid there. If there's not, then we've got to think again about why you're feeling so big down below. OK. Yeah, I mean, down here, it's not so bad. You know,
No,
I mean,
it's first thing in
there
the
is
morning, it's
something.
mainly my feet and that.
Yeah,
Top
so
of my
it's
ankles.
not as bad as I would expect for that to be causing a problem in here. So that's why, and nothing on the chest.
Right, OK.
So that's why I'm not too worried that your heart's being that bad. So
Yeah.
which is why we need to do that.
OK, David. OK, thank you very much, David. Cheers.
Okay,
Thank
mate.
you.
Russell said, what do you want for dinner? Which means he's cooking and he's also feeding. It's because we had words last night. I was like, if I'm on a
You don't want to go out
late...
for a drink with your mum tonight, that's why.
Yeah, I was like, if I'm on a late, do not expect me to cook. Like, I can't cook anywhere. Can you cook? Oh, God. Must be just me. Hello, it's Dr. Hyder. Come and have a seat. And how are you?
I've got a lump on my throat. I went to the other surgery and they just told me to come here today.
Yeah, you've had some antibiotics,
yeah,
haven't you?
I've got 3 left to take.
Okay. Painful or not?
It was. It's not now.
And how long has it been there in total?
Since Thursday.
Okay.
Yeah.
All right. So it was painful. Now
Yeah.
it's not.
It's not as bad as it was.
Oh, yeah. Swallowing difficulty at all? Are you a smoker?
No.
Alcohol?
Now and again.
Okay. It feels like it could be a salivary gland. Sorry, is that
Yeah.
tender when I'm pressing
a
it?
little bit.
So it's a bit tender as
Yeah.
well. Sometimes you get a swollen lymph node if you've had a viral infection. Have you had any illnesses at all? No. Sometimes it can be to do with your salivary gland, and a small stone can get blocked in there, causing the swelling.
Yeah.
But either way, we need to find out why. So we need to do a scan, an ultrasound scan, to have a look at it.
Right.
Does that sound reasonable to you?
Yeah.
And I'll just have a look at the back of your mouth as well. You just do a big ah. And lift your tongue up if you can, like this. Yeah, that's fine. Okay, that's fine. So usually if it's a salivary gland stone, people notice when they're chewing, it gets more painful and it can get bigger.
Oh, right.
But you haven't
Not
noticed
noticed,
that?
No. Nobody sort of said anything to me
Yeah.
about.
Yeah.
I just said suck on lemons and.
Yes, so that's right, actually.
Yeah.
So if you've got a stone in there and you suck on really sour things, it causes your salivary glands to produce more saliva and it can push the stone out. So that's the idea. I just want to feel what size it is. Just pop your chin down again. Just. Sorry to sort of prod around. What I'm going to do is I'm going to request the scan urgently.
Yeah.
If it all comes back as a salivary gland, that's reassuring. If it comes back as one lymph node, just one lymph node on its own, we sometimes refer those in for a biopsy. The reassuring thing is it's not likely to be something sinister if you're a non-smoker and you don't drink.
Yeah. I used to smoke.
When did you stop?
9 months ago.
OK, and how much did you used to smoke?
About 15 a day.
OK. That changes things a little bit in my mind. Because what I don't want to happen is for you to be waiting ages for a scan and then something happens and it changes. So let's see how quickly they see the urgent ones if I press. OK. So if they're going to see you within 10 days, can I see you in 2 weeks?
Yeah.
So then at least we can look at the results and if it's still there, decide what to do.
OK.
If they say it looks completely fine, then that's great. If it's still there and they haven't really found out what it is, I think we'll be referring you on to a specialist.
Okay.
So can I see you on the Thursday, the 20th? I've got 5:20.
Yeah.
5:20. All right, so I'll see you then and you'll have your scan before then.
Yeah.
Take care then, bye-bye.
Adam Brown. Hi, Steph. Come and have a seat.
Your voice just popped up.
So I think I know what this is about. Come and have a seat. Can you get it back in all the way? Because I could partially reduce it.
I can get it all back.
Yeah.
But the moment that you let go of it,
it comes back out.
It comes back.
I think you need to have it done, to be honest. So I'm going to do that referral.
You know what happened, do you?
Yeah. So I remember you told me in the.
Well, they gave me the
anaesthetic.
Anaesthetic.
Yeah.
And apparently, everything went into meltdown sort of thing.
Okay.
The breathing, lungs went into spasms, and apparently I was in a bit of a tricky situation.
I'm on till 8 anyway, and I'm in at 8, so yes, I'm only going home for a couple of hours again.
I'm actually here to ask if I could get another sick note.
Will you tell them, please stop sending my patients upstairs?
Yeah.
They're still sending them. I've asked them about 6 times.
OK, well, she can get a job here, can't she?
I've got a full-time job at home with him.
Dr. Allen has asked if Nithi and Alicia can move their cars, please. Lovely, thank you.
Come on in and have a seat. So, we spoke on the phone, and I think you saw Dr. Kochar, didn't you?
I did.
A week or 2 ago? So, feeling very tired.
Yeah.
Is that right?
Yeah, I've since caught some stupid cold.
Right,
Which
OK.
I suppose I'd expect. Because what basically happened is trying to be a carer and work in Reading out of Slough, 30 miles there and back, and working in mental health NHS, it's sort of taken its toll.
It all got a bit much, did it?
Yeah, I can't physically or mentally do it anymore because I'm
Right.
finding it's more the physical part. And because I work in mental health, I'm very aware of, like, stop, because it can get edgy.
What do you mean edgy?
Edgy, it's like you think, oh, I can't even think about all this anymore because it makes you ill.
Sue is a lady who I've looked after for many years. She's always worked in the caring professions and in mental health, and she has had some work-related stress in the past. Most recently, she's been seeing us with concerns around the fact that she's the sole carer for her 91-year-old aunt who lives with her.
So, are you getting enough help, Susan, with her?
No, at the moment we've got no one. Got a very good social worker locally, and she's going to help us to get new carers quite soon.
Have you spoken to work about the situation?
Yeah, that's been ongoing. That's I work for
How
the
long
NHS.
I mean, how long have you been mentioning it at work?
Oh, over the last few years, I guess.
There's good evidence that carers are more at risk of stress and anxiety and depression. This is obviously because caring for someone can be a stressful experience. Carers often feel guilty about the fact that they're more mobile, more fit and healthy than the person they're looking after for. There can sometimes be a sense of entrapment, and there's often a financial implication as well.
So Dr. Koshar did a lot of bloods. They've all come back as fine, which is good. So
I'm amazed at that. I thought I might have had a bit of a...
What did you think?
I must be
about that?
very healthy, bloody wise.
I don't know that you're very healthy, but...
Well, it's because I'm a worn-out person.
I suppose what I'm saying is that there wasn't anything we picked up in the bloods. So, how do we move this forward, Susan?
I just feel I need a bit more time off, to be honest, because I need to get... Well, firstly, because my body's not quite ready. I still do get a bit tired, but I think that's because I went and got this cold as well.
So I need to extend your certificate that he gave
Well,
you,
that would
yeah?
be helpful because of
Okay.
the fact of I just need my body to pick up a bit more.
Couple more weeks?
Yeah, would help.
Okay. The certificate runs out when, Susan?
Oh, I think it ran out yesterday.
Okay. You don't need to talk to anyone about all of this stress, talking therapies?
No, I've left that because the simple reason is, although there's a lot going on and a lot happening, I think that because I'm very aware of mental health, things do iron themselves out.
Okay.
And it's time that normally does it, and I think it actually helps me, the fact that I've worked in acute mental health.
Because it makes you more aware of
Of
the
yeah,
issues.
that when you become edgy and you think don't think like that. Do you know what I mean? And what I mean by that is like, don't think about you might become ill in that manner, because you don't need to. So you can empower yourself, your own mind. You know.
You've beautifully identified the things that are causing you the issues, aren't they? We've ruled out anything physical that could be exacerbating everything. Which is of course good. So it's now dealing with that, isn't it? So you're seeing occupational health this morning?
Yeah, I'm going to see them about 2:00, and they're very nice as well.
Excellent.
Yeah, I just think the government, if it woke up a bit and allowed me to, sort of like, there's thousands of women. It's women at the moment.
I know.
Well, it's nice seeing you again.
Yes, long time no see.
And you're a brilliant doctor, I have to say, and always will be.
You take care of yourself, Susan, OK?
I will.
Bye-bye.
Thanks for seeing me.
No problem. Bye-bye.
I don't really know what happened.
Okay.
And then I got a copy letter that said that the heart and something else was normal.
Yeah.
Which is something else that they brought up.
Okay.
Lungs were clear. So I don't really know what the next step is. That was all. I just wanted to come and have a quick chat with you to see what the next course of action was.
What I've got is, what this basically said is that you went into bronchospasm with high airway pressure. It was difficult to continue with general anaesthetic, wheezy and not safe to proceed. Dr. O'Connor treated with adrenaline hydrocortisone. Yeah, okay, so pretty serious, wasn't it? So did you see anybody afterwards?
Yeah, I saw
a chest consultant.
A chest man, a heart man.
Yeah, and what did they say to you?
Nothing really.
The steps are, you need to be seen from the chest point of view to figure out what your risk is for doing this again, and whether then an anaesthetist to decide with that information, do they do an epidural, do they try and do it again, do they use a different anaesthetic agent, that sort of stuff. So there's 2 steps before you get to the surgeons.
Sure.
Once that's all been sorted out, then you go to the surgeons. Now the thing about this is, it would be better to have those 2 steps done in the same hospital where you intend to have the surgery, because at least they're all in the same departments, can talk to each other easily, and letters can be seen on the same system.
Gotcha. Yeah.
What's the reason behind why it's been left so long then?
It just went on.
But what I'm saying is, between 2011 and when I saw you, it was the fear, wasn't it, that was keeping you away?
Yeah, I think it probably was. Yeah.
So the question, so what I'm trying to say is, I want to know that you're actually going to be okay once you get in the front door. I don't want you to then sort of think, oh, I'm not doing this again, because that's what happened last time, isn't it? I sort of referred you and then you didn't go, I think.
I didn't do anything. That was me being absolutely lazy. Okay. So I mean, yes, let's do that. It's on your head though.
Thanks.
No, let's do that.
So I'm going to write 1 letter that I'm going to copy into all those 3 specialties. In the meantime, do you remember I told you, if this gets to the stage where you can't push it back in at all, or it starts becoming really painful, or starts turning a different colour, that sort of thing, then you need to see us on the same day, because that would be an emergency admission.
You know, I'm all okay with that at the moment.
Yeah. OK, so I'll get the ball rolling. If you don't hear from anyone in the next 6 weeks, you need to let us know, just in case something's gone wrong in the referral chain.
Yeah.
Yeah? OK, good. Take care.
And you.
Take care, okay?
Yeah, stay
See
well.
you. Yeah, you too. Bye.
You're asking the person that's been here longer than you to make you a coffee. That doesn't work here. Newbies always make the coffee.
Are you going to get the phone then? I'll
Get the phone and then make the coffee out.
Do I say fan and road cancellation line, Kerry speaking?
That's it. Why you do that?
Come out that way. Fan and road, Kerry speaking, cancellation line.
Denise Morgan. Hello.
Good morning.
Dr. Rice, have a seat.
Oh dear. I came here a couple of months ago. I suffer with plantar fasciitis. I went and see the podiatrist. She gave me some exercises, but I find just a couple of days, the pain is unbearable. I'm on my feet all day long, and now it's hurting me even when I'm in bed.
Mm-hmm. And how long have you had it for?
Since February, actually.
Okay, wait, have a look. Which foot's it in?
This one.
This one. That's right. I can't help noticing that your shoes, you haven't got any insole or support in here.
They haven't given me anything yet. I have to wear something with a raised heel.
Right, okay.
Or else it's just impossible.
Because what's causing it is what's plantar fasciitis is that you have the arch of your foot here. It's like the arch collapsing. And what the best treatment is to go and buy an insole or to get some shoes that support this part of the foot. But it's caused by footwear. So these shoes here, you see, they're quite flat. There's no difference across here. You need to have something here to support it. And if it's flat like this, having an insole that just has a little bit of arch support, that's what you need. Because what happens, the foot's quite complex, as you know. So these are the bones of the foot which form an arch. And this one here is connected to the heel bone by something called the plantar fascia.
Yeah.
And then it pulls it in.
Yeah.
And what happens, if you don't support this, the weight of the foot starts to push down on it, and that stretches this, and that causes the pain here on the heel where you're getting it. This is the plantar fascia, so plantar fasciitis means inflammation here at that point. And the arch takes all the weight off the plantar fascia, so the arch support. So that's, in my view, that nearly always works. The other options are physiotherapy sometimes helps, painkillers, and I've once given someone an injection. How are you hoping they could help today?
Anything that would take the pain away, because it really make me a bit disabled.
I'm sure, yes. Are you able to go to work?
I can tolerate pain, but this one just sort of, and it's a bit embarrassing as well when I'm looking after patients and hobbling around. But it won't stop me from going to work. Okay. It has to be really at the point of. But I don't know what to do, to be quite honest.
Okay, that's, as I said, that's my advice. That nearly always works.
Get some insoles and see how it If not,
then, yeah. Okay, I hope that helps. It usually, as I say, it usually does.
Yes.
Yeah. Yeah. But it's very painful. I understand how difficult it can be. Yeah. Okay. Okay, let me get the door for you. Okay. Okay. Bye-bye.
Thank you. Bye-bye.
Adam?
Hi, Ed. I'm good. Come through, come and go see. Thank you for waiting, Ed.
That's all right.
How can I help today?
Basically, I come here, I think, like a month ago. They gave me some antidepressants.
Okay.
Since then, I've took them, like, basically, I stopped eating, things like that. I don't know, they affected me in a way where it's like, I don't know, I don't find them helpful.
Okay, how's your mood been since you started the medication?
Basically, I've spiraled out of control, yeah. Basically, pushing everyone away for that supporting me, and like my sleep patterns no good. I've turned to drugs.
Adam, I'm glad you came in today, buddy, okay? Because there's lots of things that we can do to help. And it's good that instead of letting it continue to spiral out of control, you've come in to see us so that we can work on the next steps, okay? There's a couple of things I wanted to ask. How long have you been feeling down for?
Months, man, months.
Is there anything in particular that's making you feel down?
Do you know what it is? It's like lack of sleep, my eating. It's like, you know, all them little things are affecting me. Then I'm at home and, you know, got kids and, you know, my missus, and when we have a little argument, the way I deal with my coping mechanism, to deal with problems is to basically go to drugs.
Okay, and which drugs are you using at the moment?
Like probably £30 to £20 a day.
Which ones?
Crack.
The number one thing, of course, is we need to get you feeling better. We need to improve your mood. But coming off the drugs is an essential part of that whole process, okay? There's a very, very good team in Slough called Turning Point. Have you heard of Turning Point?
No, I've worked with... Do you know what it is? If you want to stop, you'll stop. Basically, I'm using the drug as an upper because when I'm so shitty and so down, I'm using it to bring myself out of what I'm feeling. Do you know what I mean? Eating, I'll probably eat a decent meal a day.
Yeah.
And then when I smoke, I sick it up.
Okay.
I make myself smoke that much till I'm sick. Do you know what I mean? It's like, and I'm not happy. I'm not happy with smoking.
Adam,
I've been to probation.
I'm just going to slow you down a second, okay? Because I want to make sure that we get all these important points talked about, okay? So you mentioned about the sleep, that you wake up 8 to 9 times a night. Are you thinking about a lot of things when you wake up?
Yeah, probably. That's why I'm stressed.
I have to ask, this is a really important question. Have you had any thoughts about hurting yourself or harming yourself?
Yeah, basically I have, yeah.
And what thoughts have you had?
I like cut my wrists and things like that.
Were you thinking about it or you've done it?
No, I've just done it. Basically, I just cut myself and that, innit? Like little minor things, nothing like... It's my own little mercy, do you know what I mean? It's my, like, do you know what I mean? It's nothing...
The other side as well?
No, not the other side. But do you know what I mean? It's just...
Adam, did you regret what you did?
Yeah, I regret everything because this isn't me. I'm not an addict. I'm not... Do you know what I mean? This is the way I deal with my problems. I don't want to go out and hurt no one else, but my actions are affecting my family, like my kids, and then my whereabouts, where I am, what I'm doing.
Adam, I have to ask, so you did that a couple of weeks ago.
Yeah.
Since then, have you had any thoughts about hurting yourself or harming yourself?
Just to tell the truth, it's sad. It's sad the way I'm living. Do you know what I mean? Even my clothes are disowning me. It's like nothing seems to fit me. I've lost so much weight.
Adam, so is there anything that would stop you from hurting yourself or harming yourself? Thoughts about your children?
Yeah, that's the only positive I have in my life. Do you know what I mean? Without them, I don't know where I'd be. I'd probably be locked up.
We need to help get you better, okay? You mentioned about the medication. Now, the difficulty is the symptoms that you're mentioning are in keeping with clinical depression. So the fact that you're not eating and you're not sleeping, I don't think it's part of the medication. I think that's all part of how you're feeling. Does that make sense?
I'm losing like so much.
Are you happy to try a different medication?
Yeah, but I just think that there ain't nothing. I need something to gain weight. I need to put get my health back. Because
Adam, we're going to go.
At the moment, I'm just taking pills after pills and smoking tobacco and.
Okay,
do you know what I mean?
Here's what I want you to do. Okay, I'm going to explain to you exactly what we're going to do. I'm going to explain everything, and then we'll go through it. Okay. Number one, I'm going to refer you to our psychiatric service. Okay. Number two, medication is very, very effective in patients who are suffering with depression and anxiety and anger issues, okay? The third thing is the drugs. We need to get you off these drugs, okay? The illicit drugs is an absolute no-no, and it will make your situation far worse. You know, you're spending all this money a day, it's going to be affecting your mood, it's going to be affecting your physical health. And, you know, it's a dangerous drug, crack cocaine, which is why it's a Class A drug.
Is there any chance I can get something to help me sleep? Because that's my main thing, because when I'm not sleeping, I'm going out.
Absolutely. So, let me do that. Have you heard of the crisis team?
No.
Okay. The crisis team is a team that's there that if you feel your mood's deteriorating and you're feeling like you want to hurt yourself or harm yourself, call this number. Let me give you the medication. Let me book your follow-up appointment. So in 2 weeks' time, on Monday the 3rd, so I'm booking you in right now, okay? Before this appointment, Adam, you will have taken 2 weeks of this medication, which is essentially the antidepressant medication. This, I'm going to give you some sleeping tablets to help you. You should have been contacted by the mental health team, okay? And I want you to have contacted Turning Point. Let's get this sorted. All right, Adam? It was lovely to see you. I'll see you in 2 weeks' time. No trouble.
help you today?
Well, I take morphine, but I'm in a lot of pain. It's my hip.
Okay, so how long have you had this pain for?
Only about 2 days.
2 days.
Yeah.
How did it start?
Well, it just stayed. I mean,
Were you doing anything at the time, or was it when you woke up in the morning?
I had been in the garden, but I don't do anything exciting in the garden. You know what I mean? Because I can't lift things and things.
Yeah.
So I
What
just
were you doing in the garden then?
I just potter.
Yeah. Had you been bending on the ground?
I have bent down, yeah. So you have to kneel to get to a flower bed, don't you?
Yeah. Is it okay if I examine your hip?
Yeah, yeah.
Yeah. Do you think that you'd be able to lie down on here if I change? Do you mind taking the trousers off, actually? It'll be a bit easier. That's fine.
That's really hurting me now.
Yeah. What are these old scars from?
Burns.
How long ago was that?
When I was 13.
What happened?
Fireworks.
Oh, my goodness.
Fireworks in your pockets.
And they went off?
Yeah. Took skin off there to put on there. Because there was no skin on this side.
Oh, so this is not a burn on this side?
No, that's not a burn,
It's from
that's
a graft.
skin graft. We're talking 40 years ago.
Can I get you to bend this knee, if that's all right? That's okay.
And it feels okay.
I'm going to gently do this side.
Yeah.
Pain?
Yeah,
Right now. What about
starting to.
that?
Yeah, when
Yeah,
you move
sorry.
it that
I'm
way.
so sorry.
See, the pain I find is just about there.
Okay, I'll let you get dressed. Just be careful and steps just here if you need it getting off.
See, I can hardly get up, you see. Normally I can get up and things, but I can't now.
Do you need a hand or are you okay?
No, I'm fine, love. Thank you for the offer.
When you're going to the toilet, any problems passing urine or opening your bowels? Have you got full control over that?
Yeah,
Yeah?
it's fine.
And any numbness, weakness or tingling of your legs since you've had the hip pain?
No, I haven't noticed it since then.
Okay, all right. I think what we should do is get an X-ray
Yeah.
of your hip to check that there's no joint problem with your hip.
Mm.
But can I also get you to see me in about 1 to 2 weeks' time to see how you're getting on?
Mm. Yeah.
If things get worse in the meantime...
I will do. I'll come back. Don't worry.
But in particular, numbness, weakness and tingling of both of your legs, or you've lost control of your bowels or bladder, can you make sure that you see us straight away?
I will do.
Yeah?
I will do.
OK. If you're in a lot of pain with the hip, you can take a little bit of the Oromorph to top it up if you need to. You know about that as well. I can see you on the 19th.
Yeah, that'll be fine, anytime.
And hopefully we'll have the result back by then of your X-ray. That's fine.
Thank you, Doctor.
All right, see you soon. Take care. Bye.
Have a nice day.
Bye.